But we also talked about the front page of the Sun today. Prickly cum dancing, strictly vaccine scandal. The three strictly pro dancers have apparently declined to get jabbed. A number of the celebrity partners are apparently worrying. They're saying we should have been protected. Clearly, they don't understand anything about COVID because, of course, with the Delta variant, the being vaccinated doesn't stop you necessarily from getting COVID or from passing it on. But the Prime Minister was asked about this during his US trip, and he urged the three to get jabbed as soon as possible. But asking the Minister earlier, should people face losing their jobs? Well, we didn't quite get to an answer, but I'm not entirely sure where the Prime Minister or the Environment Secretary stand on that. But let's talk to Dr. Peter English. He's a retired consultant on communicable diseases and is a past chair of the British Medical Association Public Health Committee. Good morning to you, Peter.
Good morning, Julia.
Should these Strictly Come dancers, pro dancers, should they be axed from the show if they refuse to be jabbed?
Yes, you got it completely wrong about vaccines a moment ago. Vaccination does make you less likely to be infected. If you've had 2 doses of vaccine, you're a lot less likely to be infectious and infected. And if you do get infected, you're likely to be infectious for a much shorter time.
So I said it doesn't. I said it doesn't stop you, so I didn't get it completely wrong, did I?
You did get it completely wrong. You implied that it doesn't have any effect.
I didn't imply anything. I didn't imply anything. I said having the vaccine doesn't stop you from getting the virus or giving it to someone else, which it doesn't.
It makes it extremely much less likely. It's like saying, with your line of reasoning, if you were being forced to put a gun to your head with 5 bullets in the cylinder and told, actually, you can take 2 of them out, so you reduce your chances of getting shot, you wouldn't bother because you'd still have some bullets in there and it still might kill you.
Okay. No, I would certainly bother. I'm double jabbed. I'm 53 years old, and it seemed to me to be a reasonable thing for someone of my age to do.
The line of reasoning that says that there's no point in worrying about whether they're vaccinated because they could still be infectious is false, because they're a lot less likely to be infectious. Okay, so it's important that people understand that vaccination does provide a lot of protection. It's not absolute.
I didn't. No, Peter, you started by saying I got it completely wrong. I didn't get it completely wrong. I was very careful what I said. I do completely understand the difference between stopping and cutting down. There's a reason why I'm delighted and was thrilled that my parents got the jab, because they're at higher risk. Now, the reality is that because the people who are worried about this and are scared about this, of dancing with a pro dancer who's not jabbed, they themselves have been double jabbed. Otherwise, they wouldn't be making such a fuss about this. They are therefore already having that protection, and it's an incredibly high protection, as you pointed out, from getting seriously ill, risk of being hospitalised or, God forbid, dying of COVID. And particularly, by the way, very, very low risk of dying of COVID for any of the people involved on Strictly, given their age and their level of health as well, given that we know how much this affects people who either have underlying health needs, are obese, or obviously particularly the key issue there is older age. So why should somebody who is double jabbed, who's got that protection themselves, who's not a high risk person like a very elderly person in a care home or someone with being treated for cancer or something at the time, why should they be concerned whether someone they're in close contact with is not jabbed?
Because the jabs, 2 doses of the jab is about 95% protective, preventing you from getting seriously ill, requiring hospital admission. That still means there's a 1 in 20 chance that you won't be protected. Now, for the small harm, it's negligible harm done to the pro dancers by requiring them to be vaccinated, you can cut down that risk, that 1 in 20 risk that still remains, to a much lower risk. It's about reducing the risks as far as you can with reasonable, proportionate measures which do no harm.
Okay, and you were saying a reasonable, proportionate measure that does no harm would be someone not basically being sacked from their job because they won't get medical treatment that they choose not to have.
Well, I'm not an employment lawyer, and I have no idea what their contracts say, but there's no requirement for those dancers to be actually dancing. Even if the BBC has been negligent enough to allow them to have contracts that allow them to refuse vaccination, they can still be paid and another dancer can be put in their place.
I find it extraordinary that you regard this as reasonable and proportionate.
Of course it's reasonable and proportionate. There's no harm done to those dancers. If they're so bullheaded as to refuse to be vaccinated, then they shouldn't be given that public platform.
What if those dancers are in their 20s, young, healthy people? What if they've already had COVID And they know
They
that
still
as
have
the
no right to
well,
put others at risk
but they're
by
not putting others
refusing
at risk
that.
because we know
Yes, they are.
the data is very clear, Peter, that those who've already had COVID have got greater immunity than those who've had a double jab, in which case they're not putting anyone at risk.
Yes, they are. There's still a risk that they could be infected and infect
There's
others
still a
in the
risk
set, others on the
There's
cast.
still a risk that the person who's double jabbed could be at risk. We take risks
Yes.
in everyday life all the time.
There is a risk, but we manage the risks. We take proportionate measures. It's completely proportionate to say we will not employ dancers who are not double jabbed for this role because there's a risk to it upsetting our schedules, upsetting the team with everybody having to
Now it's about upsetting people, not saving lives.
It's upsetting the schedules. It's about it's up that too. If you're an employer, if you're the BBC, you certainly don't want your celebrities to be harmed by getting COVID because one of your dancers was infectious.
But
Peter, any of
the dancers could be infectious. Anyone, whether they're jabbed or unjabbed.
If they've been double jabbed, they are very, very much less likely.
And
to
I've just said, what if they are
management, controlling the risks?
Given the cohort under 30 has very high prior COVID immunity because they've been out and about and they've had COVID. We know 60% of teenagers, I believe, according to NS data, to have had COVID already and have prior immunity. Given that having a double jab after having had COVID at someone at that age is not going to give them a greater immunity, they're not going to put them at less chance of passing it on to someone who's double jabbed. Why do you insist on saying they're putting at risk?
Are not at risk of catching it. We know that
neither
lots
do
of
you.
people.
Neither do you. But
I don't know that we do.
Why should they?
I do know that if they are, then they would, because they are putting others at risk. If they are felt susceptible to catching it. And we know that if they'd been double jabbed, they would be much less likely to be putting others at risk.
Do you take the same view of the flu
others
jab?
At risk unnecessarily.
Should people be sacked if they don't get the flu jab as well? And what other?
Well, if you're a patient at the Royal Marsden Hospital, for example, where a lot of cancer patients go, then there is a requirement that all the staff members should be. It's
That's
a
hospital, Peter. It's not a dance studio.
Well, that's the same difference.
Is it?
The fact is that people are putting people at risk unnecessarily.
Do you ever
it's
leave
a context in which.
Do you ever leave your house? No, it's a genuine question. Do you ever? I mean, you seem to perceive risk everywhere.
House,
you leave your house. You go to the supermarket. You see other people.
It's about proportionate, reasonable steps to reduce risk. It's a proportionate, reasonable step to require the professional dancers and indeed the celebrities to be double jabbed before allowing them to perform on the show.
Do you require that people that you meet with socially are all double jabbed?
Pretty much, actually.
Pretty much,
I'm
or
very
everybody?
Cautious about. Well, as far as I can, I try to avoid mixing with people who aren't.
You do. And do you actually say to people, "Can you show me that you're double jabbed so I know you're safe to meet?"
Well, I don't ask them to provide me with evidential proof. I don't ask them to show me their apps to prove it. I would take people's word for it, but I certainly minimise contact with people who aren't.
Absolutely fascinating. Dr. Peter English, thank you very much. I'm sure people are going to be interested to give their thoughts on that interview.